Our group will be talking about medical bills reimbursements issues. For table of contents, I'll be doing reimbursement rates, physician's role on insurance plans. United States healthcare system will be Denise. Electronic medical records will be Melanie, and the rapper will be Esmeralda. Reimbursement rates in the United States: 43.44% payment arguments for services provided in the hospital outpatient department. 39.7% payments arguments for specified physician services provided to California Children's Services clients. Issues with medical reimbursements. In some cases, patients pay their medical expenses in hopes of receiving their full reimbursement. Drive-by physicians, they charge hospitals for their services, but the hospitals charge the patient. Also, laws do not protect patients because they must agree to the term of treatment before receiving care by signing a contract. Physicians' role on insurance plans. Hospitals do not follow these guidelines when it comes to their workers. Hospitals do not require physicians to participate in the same plan networks as a condition of receiving hospital privilege. And health plans do not require hospitals to have such agreements with hospital-based physicians. Due to medical reimbursement issues, many patients end up bankrupt due to unexpectedly high medical bills. Now I'm going to pass it on to Denise.
The United States healthcare system. The healthcare system that we have today is still a struggle for many Americans because many of them cannot afford to pay the bills that they receive from the hospitals and go into debt. Not everyone has insurance. However, most Americans that do have health insurance are through their employment. The US healthcare system lacks having to focus on one system for everybody, unlike other countries that have one system to help their citizens by lowering the cost or giving free healthcare. About 79 million Americans are in debt problems or have medical bills. 72 million who are working have medical bill problems. 7 million elderly people have medical bill problems as well. Next slide. The US has many separate healthcare systems, which are used based on people's class position. The Americans do not get the same benefits as other countries that have universal healthcare. For example, through government initiatives, regulation, and taxing, many countries around the world offer healthcare to more than 90% of their citizens. Not only does this provide most citizens with healthcare, but the governments of each country also regulate the healthcare system to ensure that the care is given sufficient and that it's taking advantage of this care. Does not provide a financial hardship to citizens. This type of healthcare system can improve the population's health and help people have access to the care they need. Other countries focus on one healthcare system that helps their citizens. 32 countries offer universal healthcare. Next slide.
So one solution could be enhancing our electronic medical records. A singular method of reimbursement cannot be effective to ensure the quality, quantity, and complexity of care for our patients. Most American patients who are seeking care, they have to deal with lack of proper treatment, excessive number of referrals, and physicians are very overworked. They have increased workload, which leads to spending less time with the patients and a decline in patient care. But using electronic medical records, it could be one way to improve the reimbursement method in order to ensure quality and quantity of care for the patients. Today, the electronic medical record is only used to enter patients' data to document their care. But in an enhanced version, will allow the medical staff, the patients, the insurance companies to access same information at the same time. This will will allow us to monitor provider practice. It will allow patients to input the data into the EMR themselves, which tells us whether they're responsive to a treatment, whether they have a side effect, or they face a complication. And this allows also to monitor that how our health organizations are functioning. This will lead to a decrease in unnecessary referrals and under-treatment of patients. And because insurance companies can directly see that what's happening to the patients, they could better manage the reimbursements. And now Esmeralda will wrap up the presentation.
So the state's healthcare is not perfect. It's far from it. The American healthcare system is one of the most expensive healthcare systems around the world. Most Americans find it challenging to pay off medical bills as they become aware of how much the bill will be after the hospital visit. When patients receive care from drive-by doctors, they are unaware that drive-by doctors come with a cost. A possible solution for these problems can be if the government initiates regulation and taxation like other countries. The United States can offer health care to a large percentage of its citizens. Thank you for your time.